You are very welcome to this video, as you always are. Now, straight down to business today, because the European Union have underestimated the acceleration in cases. The scientific experts in my country had a best case scenario, they had a worst case scenario, and the numbers are going above the worst case scenario. So the anticipation here amongst the experts has not been great, and let's look at what I mean here. So here we see this is the per capita figure that we've been looking at lately, cases per million people. Now in Belgium and the Czech Republic, they're the worst. Belgium is leading the pack. This downward flick here is just an artifact from the weekend. In actual fact, the numbers are still going up, and this is a linear scale. Next we come to Slovenia with increasing numbers of new cases. Then as we go down, we've got France and the Netherlands, still not doing too well. Then we've got Poland and the United Kingdom. Greece numbers are going up. Numbers in Germany are going up, not quite so quickly. And we see the United States is in between the United Kingdom and Germany in terms of per capita figures. So that's the growth area. Now, the point is here that the Czech Republic and Belgium are getting close to their healthcare provision capacity. Their hospitals are pretty well near full now. So this is going to create obvious difficulties. So I don't want to be alarmist. I want to base this on the evidence. So Czech Republic, population 10.7 million, has extended its state of emergency to the 20th of November. But we've talked to people in the Czech Republic, and it was on this video just a week or two ago, and the necessary measures simply weren't being taken. Now, this chap Peter Liese, German MEP health expert, speaks with the European Union. Obviously, he says we need to reduce contacts, and then he says this: regrettably, Belgium and the Czech Republic are too late, so that their health systems are already overloaded. Not yet overwhelmed, but already overloaded, and we don't need to guess about what's going to happen because we can see the direction of these lines as the number of cases increase. So that's the Czech Republic. Belgium, population in Belgium 11 million. Current prevalence, people with the virus now at least 300,000. Now let's assume 5% get sick. And remember, Belgium's a country of only 11 million people. That's potentially 15,000 people needing healthcare in the next few weeks as a result of that. Because remember what happens, if we go back to this rather nice graphic from the East Virginia Medical School, that people get the infection, then the virus goes away, then they get the inflammatory reaction, and it's this inflammatory reaction which is dangerous, that kills people. But remember, so that's when they get infected, that's when they first get symptoms. And then it's quite a long time, these long delays before potential severe illness requiring, say, hospitalisation, requiring intensive care and potential death. So we have this significant delay, as we know. So it looks like about 15,000 people are probably going to be requiring hospital care in Belgium in the next few weeks, and that is a lot. Friday the 30th of October. This was announced on Friday the 30th of October. From Monday, that's tomorrow, more things closing in Belgium. Now, this doctor here, the president of the medical union in Belgium, 10 days' time, there'll be only one bed remaining and 2 patients. This is a direct quote, it's in italics. So what he's clearly saying here is there's going to be more patients than beds available in 10 days' time in Belgium. The doctors will have to choose which one of 2 patients will be able to be in the only bed we have. So this is pretty stark language from the president of the medical union of Belgium. Now, traditionally, what's happened in Belgium is when they have very difficult cases or they're full, they send patients to Germany. But of course, Germany's got its own problems as well. So how possible is this going to be? So in Germany, there's increased restrictions from Monday. Angela Merkel, if infections in Germany continue at this rate, we will push our health system to its limits. And that bit there is a direct quote from Chancellor Angela Merkel. And this German MEP health expert again, European Union had underestimated the impact of COVID-19. Some member states' healthcare systems are just days away from collapsing. Stark language indeed. People seem to take their eye off the ball somewhat in summertime. Now, what we need to do here, and I don't know what provisions being made for this. I can't say I'm aware of many provisions being made for this, but we need people who can be given medical treatment at home if they can't get into hospital. So ideally they could be given oxygen. They could titrate against their oxygen saturations, as we've done quite a few times on this channel. This simple device. I mean, how simple is that? You know, everyone should have one of these at home. What's my oxygen saturations? My oxygen saturations are currently 97 and my heart rate's a bit up, which is, you probably, there's a physiological evidence of my agitation here from these numbers. Okay, I was 101, heck, 100, 99, need to chill out a bit. Right, anyway, when you look at these things, it becomes addictive. So heart rate's down to 94. Anyway, my oxygen saturations are 98. That's how easy it is to do at home. We need to have these. But at the start of this pandemic, people focused very much on making ventilators rather than making simple oxygen concentrators and oxygen delivery systems. So we don't have that many of those that we can sort of give out to the population, really. People became somewhat complacent over summertime and weren't really preparing for this wave that we have been warning about, we have been knowing is coming. And yet people still seem to be unprepared. How can the entire European Union, with all the medical expertise at its disposal, be unprepared? You know, how can they underestimate so much? But anyway, they did. So what we need really is to try and treat more people at home. And this is the East Virginia Medical School thing. So like giving anti-inflammatory drugs, this is a steroid-dependent, steroid-treatable disease in many respects. But the treatment, the timing is critical. We don't want to be given steroids when the virus is there, but we do want to give it to treat that. And here we see they're recommending 40 milligrams 12 hourly, every 12 hours, up to 80 milligrams every 12 hours. We don't use that Q in the UK, actually. It just means every. We express it a different way. Anyway, it doesn't matter. So there are simple things that can be done at home. Let's hope plenty of supplies of methylprednisolone or dexamethasone or the steroids are readily available. The steroids that will dampen down this severe inflammation, which is the main life-threatening feature. Right, so that's the situation in those countries. Now, other countries, even Greece is increasing as we looked at that. New lockdown measures start from Tuesday, things shut, lasting till the end of November. But the point is, the Greek numbers here are way less, but the Greek government has anticipated much better. It's putting in interventions when the numbers are lower. Quite a few of us have waited a bit late. Austria, just to give another European example, partial second lockdown from Tuesday, people staying at home overnight if at all possible. Now, schools and non-essential shops are allowed to remain open, and as we'll see, that's the same in the UK, and I'm just wondering if this is the big weakness in the strategy. More on that when we come to look at the UK, which we're going to do now, in fact. So England basically, so in Scotland they have the 5-tier system. Wales is already basically locked down. Travel between England and Wales is supposed to be for only essential purposes. The First Minister of Scotland, Nicola Sturgeon, doesn't want people to go to England across the border unless it's an essential journey. So basically we're seeing leaders wanting to close off England, Scotland and Wales. There still is traffic going back and forward across, but I suspect that might be tightened as time goes on. So England closed 4 weeks from Thursday. From Thursday until the start of December, you must stay at home. Direct quote from the Prime Minister. Unless we act, we could see deaths in this country running at several thousand per day. Direct quote from the Prime Minister. Well above the worst case scenario that the Scientific Advisory Group for Emergencies forecast just a few weeks ago. I can't say I'm impressed by the level of forecasting accuracy. Now, I'm not going to do all the regulations in the UK in detail. This information is readily available. Basically, it's a fairly comprehensive lockdown, fairly similar to the one we had earlier in the year, with this exception. Schools, universities and colleges will remain open. Now, I suspect the universities aren't so bad. They're kind of self-contained, and the students usually live away from home, but younger children are going home every night. Now, I know a lot of people are saying that the infection doesn't spread that much in children, but we've got so many cases where it has. So I think having the schools remaining open is the biggest weakness in this strategy. Construction and manufacturing work open. No indoor household mixing. Now, this one is so important. So important. And that's from this Thursday. But of course, I would strongly advise that we implement this now. And religious services will be stopped for the 4-week period, and limited international travel, which is already way down. So that's the review from the UK. Now, moving on to the United States. Now, I'm not going to bore you with... it's a Sunday evening now. I'm not going to bore you with lots of numbers. But we did see that the United States, in terms of per capita cases, is got less cases than the United Kingdom, which is good, but more than Germany and Greece. And the politicisation of things in the United States now has reached a new fever pitch, so I'm going to be a bit guarded in what I say. There probably will be more to say after the 3rd of November, but for now I'm going to give some quotes from Dr. Anthony Fauci. We're in for a whole lot of hurt. It's not a good situation. Direct quotes from the Washington Post. All the stars are aligned in the wrong places, in the wrong place. As you go into the fall and winter season, with people congregating at home indoors, this is the biggie. We must stop different households from socialising indoors. Outdoors with social distancing is one thing. Indoors is a much more dangerous thing, especially if the heating's on, especially if the window's shut and we're not ventilating. This is the big one. And shops and essential places like that, where we need to buy groceries, need to remain open. But I don't know what it's like in the United States, but in England the ventilation is rubbish. The hand hygiene is brilliant. The social distancing is brilliant. The mask wearing is nearly 100%. The ventilation is rubbish. They're not letting through breezes go through shops. We need to have through breezes to dilute any viral load. Why don't people get that bit? Dr. Fauci again, you cannot possibly be positioned more poorly. Dr. Fauci said we need an abrupt change in public health practices and behaviours. And we know what this is. Hands, hygiene, face, mask covering, space, social distancing, space, no family mixing, ventilation, and I think vitamin D's probably got a role to play as well, because we're not making it now because the sun's not out in the sky, unless you're in Florida or somewhere. Dr. Fauci again, cases could pass 100,000 cases a day soon. As of now, that was the figure for last week, so it's not too far off it, is it? That was the figure for the last 7 days. Dr. Fauci says rising deaths in the coming week. So that's Dr. Fauci's review of the United States. Now, Australia, no new cases in 24 hours. Right, that's a zero. No new cases in 24 hours. Not bad. Now, lessons to learn from Taiwan. 22.5 million, island off the coast of mainland China. They had 550 cases and 7 deaths, and that was all a while ago. Immediately they had and still have mandatory mask wearing on public transport, digital registration for some events so they know who's going to be there, isolation of people with symptoms, and that is monitored, enforced, encouraged, educated, all those sort of things. But now they're back to normal life. They don't have these restrictions now. Things are back to normal. It's been 202 days with no local community transmission. How many months is that? 202 days. No locally transmitted cases. They completely stopped, blocked the whole outbreak. 22 million. It's an island, same as the UK is an island. Mandated quarantine for new arrivals, and so far they've quarantined 340,000, and it's worked every time. They haven't let anyone out who's caused any community transmission, unlike Victoria, where a few escaped and caused that outbreak in Victoria in Australia. In Taiwan, it worked, was made to work. The people were educated, cooperated, understood, and went with it. But just in case they didn't, it was monitored by the Central Epidemic Command Centre. Central Epidemic Command Centre. So in Taiwan, they have a Central Epidemic Command Centre. I've never heard of such a place in England. If there is, I don't know where it is. Or Scotland, or Ireland, or France, or the United States. They have a Central Epidemic Command Centre that supervised all of this activity. And the police are involved to enforce, and they use tracking by mobile phones. Right, and the result of this is 202 days with no localised transmission. Now, what was the difference? Now, I just want to do a quick parenthesis, really. This is about SARS, the 2003 outbreak, severe acute respiratory syndrome, what we could call coronavirus type 1. So 14th of March to the 30th of July 2003, they had the SARS outbreak. There was 668 cases, 181 deaths, that's 27%. Of course, the real number of cases would be higher, but this gave them a fright. The actual death figure is not that high, but that's just the way their case fatality rate worked out. Risk factors were known to be increasing age, male, many were exposed to hospital contacts, having a coexisting medical disorder was a comorbidity, and they quarantined 151,000 people, and among them were 46% were subsequently diagnosed. So they quarantined lots of people in 2003, and if they hadn't done, those 46 would have escaped into the community, and these figures would have been much worse. So they learned a lot from the SARS coronavirus 1 severe acute respiratory syndrome outbreak of 2003. Now the hospitals. Now I like this bit. What they did was they took the good bits from the WHO, and we'll see what they did for the other bits in a minute. Hospitals implemented WHO infection control recommendations, which are fine. That's good. That's what they did. So what conclusions and changes did they bring about? Patients were isolated and strict hospital infection control measures were taken, both in 2003 and in 2020. They had learned, and things were supervised by this Central Epidemic Command Centre. Good, organised, thought through, implemented. Right. They strengthened its centralised disease control framework and pandemic preparations, as we've just learned, and they have an annual drill. They were expecting another pandemic, or outbreak, so they started annual drills. Isn't that a good idea? Pity we didn't do that. Now, Taiwan, for political reasons, which I'm not going to go into now, but most of you will know, have been excluded from World Health Organization briefings. They weren't given information from the World Health Organization in 2019. Hard to believe, but there you go. Therefore, they did not rely on World Health Organization information. Why has Taiwan done so well? Why did they abort it at such an early stage? Well, I can't say that. But what we can say is they did not rely on World Health Organization information. Let's go on. Professor, National Taiwan University. We couldn't get direct information from international organizations because the Chinese wouldn't have liked it. Taiwan has always been careful about what happens in mainland China. They had intelligence. They collected intelligence. Now, last time I checked, we had intelligence services in the UK. And I'm pretty sure you've got intelligence services in the United States as well. So the Central Epidemic Command Center of Taiwan tried to get information from informal channels because they were excluded. A lot of the information came apparently from social media. Well, where was I getting all this from? This was from, there was a good report in The Guardian about this, well-researched report in The Guardian. The Guardian's public access, so do click on that for yourself and check on this information. And of course, looking back, we now believe that the outbreak in Wuhan began much earlier than was originally thought, stroke declared. They restricted flights at an early stage. You know, we've looked at this on this channel before. The World Health Organization was saying, "No, just go on, carry on in and out of flying in and out of China. It's all fine." But it wasn't fine, was it? That caused the pandemic. Taiwan anticipated that. We didn't seem to manage. You see why I'm getting angry about this? I'm not showing it, but I am. The Taiwanese managed and we didn't. And we just carried on flying as if things are normal. I mean, not flying. What you've got to bear in mind is flying is a fundamental human right, isn't it? Or so we seem to think. You can't stop people flying. I mean, whatever next? It was just unimaginable that they could stop flights out of China, but the Taiwanese did, and the World Health Organization was saying, I can't remember now, it was February, March, they were saying it was okay, wasn't it? And in this country as well, February, the reason we got lots of cases in February in the UK, January, February in the UK, is because people were flying to Italy for skiing. I mean, how many people can afford to fly to Italy to ski? So a few people that could afford to take these flights to Italy and have nice skiing holidays, they brought the pandemic back to the UK because the early viruses in the UK were the ones that had taken hold in Italy. Instead of just banning flights back in January, it was just the Taiwanese managed it, the British didn't. Let's just leave it at that. Flights and travel restrictions were introduced. New technologies to monitor, track and trace potential cases. So they were doing track and trace in January and February. Even potential cases, looking at all cases. Phone tracking to allow people to quarantine at home. So people were quarantining at home, but that was basically enforced. And if they went out, the police were automatically informed. That's why they've had no cases for 202 days. Supported people, deliveries, so they supported people, home deliveries for food and everything, counselling, information, education was given. The people understood what were doing, why it was important, and surprise, surprise, they did it. Pharmacies very early on supplied masks to the population. Contactless payment was introduced very early on. Online food deliveries for people at home. And the result is things that are now normal there. Just imagine it. Normal. You know, in Taiwan you can have a few friends around for a meal. You can go to a pub and have a few drinks. You can socialise in any way you want. It's just things there are normal. Whereas in England, let's just say they are not. So there we go. Is this entire pandemic preventable? The Taiwan experience would indicate that that is the case. If we'd had transparency, firm action from the World Health Organization, clear advice at an early stage, the Taiwanese managed it by looking on social media. The very people we paid to protect us didn't manage. Hence, we are where we are, and the trajectories for this winter are not good. They are all up, and hospital capacity is becoming a problem. And this winter is going to be a difficult one. Okay, so I think that's what I wanted to say. Let's hope we learn for next time. But for now, basic things, got to do them. Got to do them. Won't be for long. It's just for the next few months. Thank you for watching. It's always good to have you in. I apologise for being over emotional on this video, but if you've watched to the end, my apologies and my congratulations for staying to the end.